Ooh. Okay. Hi everyone. Welcome to our last episode for the session. Which is Meet the Specialist, episode 4. We have here with us today Associate Professor Dr. Aizura Syafinaz binti Ahmad Adlan, who is a consultant obstetrician and gynecologist in University of Malaya Medical Center. Okay, so for today's session, we are going to start very soon. Now it's 8:53. We're going to start once we have about probably 10 viewers. So come in, guys, as well as I will give you guys an introduction about who our very interesting specialist that has come to talk today. Remember that you can leave your comments in the comment section below. Like I think in Facebook Live on laptop, you can access your comment section on this side of the page, and then if you're on your phone, then it's down here below. Okay, so coming guys, and let's meet our specialists. We're gonna have a santai session with Prof. Aizura for today. So let me just give you a rough overview about our specialist today. So today we are meeting Associate Professor Dr. Aizura Syafinaz binti Ahmad Adlan, or as we very fondly call her, Prof. Aizura. She's a consultant obstetrician and gynecologist in University of Malaya Medical Center. Prof. Aizura completed her MBBS degree in University Malaya in 2000. She was the class of 2000. And she also completed her husbandship in PPUM, and she obtained her Master's of Obstetrics and Gynaecology from UM. So you can tell that she's also born and bred from UM, very passionate person. And then she completed in 2008. She proceeded to participate for a fellowship in in gynecological endoscopy and minimally invasive therapy in Changgung Memorial Hospital, Taoyuan, Taiwan, as well as completed a clinical fellowship in reproductive medicine in Belgium. She also did an advanced hysteroscopy training in Japan in 2016. So she's not only a very accomplished academically person, she's also currently the vice chair and also a part of the training committee for minimally invasive procedures of Young APH Group, which stands for Asia Pacific Association for Gynecological Endoscopic Surgeons. And if you guys know her, she's also very, very known for her leadership abilities. She's actually the current president of our very own Medical Alumni Association, as well as our beloved college mistress for College Kediaman Ibn Sina. She's also a person known for her passion in teaching, and also in our curriculum, as she is the program coordinator for our obstetrics and gynecology posting, as well as participates in coordinating our exams, as well as she actually has been recently appointed as the head of our clinical skills unit in UM. So if you guys don't know Prof. Aizura, she's very well known for being headstrong. She has a no-nonsense attitude, so you cannot bullshit your way out with her. But even so, she's actually very easily approached by her students, and she's very passionate in improving the well-being of the medical students. So if you guys know her, yeah, very great person to deal with. Okay, so today we're gonna talk about obviously her pathway to being an obstetrician and gynecologist, as well as how she handles her work and life balance and so forth. Okay. So now we're gonna wait for a bit more people to come on in before we start the session. So yeah, okay. So guys, leave a comment if you're in. It'll be fun. Let's make the session a bit more interactive. So feel free to post anything you guys would like in the comment section, and yeah, we'll very much respond. Okay. So we've reached about 8 views for now. Keep on coming, keep on promoting, share this post, share this live so that people will join and, join us. Okay, so for those who have joined, let me go through with you again who our specialist is today. Today we are meeting Associate Professor Dr. Aizura Syafinaz binti Ahmad Adlan, or as we fondly call her, Prof. Aizura. She's currently a consultant obstetrician and gynecologist in University of Malaya Medical Center. So Prof. Aizura completed her MBBS degree in University of Malaya in 2000, as well as completed her housemanship in PPUM and obtained her Masters of Obstetrics and Gynaecology from UM. And then she proceeded to participate for a fellowship in gynecological endoscopy and minimally invasive therapy in Changgung Memorial Hospital, Taiwan. Okay, and then she proceeded to participate in a clinical fellowship in reproductive medicine in Belgium, as well as did an advanced hysteroscopy training in Japan in 2016. Okay, she is very well known for her leadership capabilities as well. So, and if you don't know, she's also currently the vice chair and also the training committee of the Young APH Group, or which stands for Asia Pacific Association for Gynecologic Endoscopic Surgeons. And she's also very known for being the college mistress for College Kediaman Ibn Sina. College Kediaman Ibn Sina, if you don't know, is where UM's medical students are currently staying. The majority of them are staying in College Kediaman Ibn Sina, and she's the college mistress. As well as she's also the president of UM Medical Alumni Association. She is also very passionate in teaching, as well as she is heavily involved in our curriculum. And what I'm mentioning is just a small part of what she has actually done for our curriculum. So she's currently the program coordinator for our obstetrics and gynecology posting. So if you guys have any questions about that, you can just ask away in the comment section below. She also participates in coordinating our exams, as well as she recently has been appointed as the head of our clinical skills unit. So if you don't know Prof. Aizura, let me tell you a bit about her. She's well known for being headstrong. She has a no-nonsense attitude, no-nonsense style. And although she is like that, she's very easily approached by her students and is very, very passionate in improving the well-being of her medical students. So, please don't miss this opportunity. Come in and join us today. Okay? All right. Also, guys, don't be afraid. Please be interactive today. I appreciate interactions very much. It'll help make this session more lively. Do drop a comment. Tell us you're here. Very much appreciate it. So yeah, okay. So we're currently at 17 people. Probably would wait a little bit for 20 people to come in, and then we can start the session. Okay. Help make this session more lively. Okay. All right. So we're at 19. I think we can start. So let me give a round of applause and add in Prof. Aizura to our session today. Okay. Hi, Prof. Yay. Welcome. Okay, Prof. So we're here with 19 people in the views. Hopefully, we'll increase. Throughout the session. It's gonna be a long session, I think. So we will start. So Prof, I dah ada bagi introduction sikit. What do you think?
I think what you said is a mouthful. I'm just impressed that you can say obstetrics and gynecology in a straight line. Yeah, I think the first criteria to become an obstetrician is probably to be able to pronounce obstetrics and gynecology.
So I boleh pass lah ni.
Boleh.
Okay.
Okay, what do you want to do now? All right, let's go.
Okay. Okay. We have a comment from Raymond saying
good evening. Okay.
Okay. Good evening, Raymond. Yeah, good evening, everyone. I think I forgot to say that. Okay. So, Prof, should we get straight, just let's
Yeah,
jump.
no nonsense, can.
Yeah, no nonsense, kind.
Alright.
Okay. Okay, so let's start with the very, very common question that I think not just us medical students and definitely specialists also, semua orang akan kena tanya benda ni bila diorang masuk medical school. Why medicine?
Okay, how far back do you want me to go?
As much as you like.
Alright, first of all, I have to tell you that I was actually, the history that you gave to was not 100% accurate.
Oh,
You're
okay.
about 99% accurate.
Oh,
You
okay.
forgot to
1%,
mention that.
1% left.
Yeah, you forgot to mention that I was actually born in PPUM in
Oh!
1975. Yeah.
Betul-betul born and bred.
Pedigree, thoroughbred, you name it. Yeah? And I don't know whether some of you are aware of Professor Emeritus Syafinaz Suratnam, who was the head of ONG for quite some time before Prof. Zawiya. He delivered me. So he delivered me. I think he just turned 83. Okay, so you can calculate how old I am. So he just turned 83 like a few days ago. Yeah. All right. Okay, why medicine was chosen as a profession now? I have the benefit of having my dad, who himself is an obstetrician. Okay.
So it runs in the family?
Yeah, well, nothing is genetic when it comes to medicine, okay? But you have the exposure. You have the exposure and you observe. You see the lifestyle. You see the respect that people give you. When you walk, people acknowledge you, because you were a human carer. You take care. You settle their medical issues. So you see that, you observe that. Growing up, my father always thought that I would be a better lawyer. He always thinks, I think until today, he thinks that I would probably be more successful if I was a lawyer. Tapi I also realized that I did not like the life that was exemplified by lawyers. Okay, the having to fight your way through right or wrong, having to find the right deal, dealing, and have you noticed that lawyers always wear black while doctors wear white? And we go into bright Kalimantan areas in the hospitals, but lawyers kan dia punya AG chambers and all that is always very dark, like as if you're trying to hide something. So I never liked it. And I never thought that, yeah, okay, you may say that I have a give of gap, but I don't think the give of gap that's what it takes to be a lawyer. So I didn't think so. So subsequently, I saw my auntie masuk asasi, and at the age of 9, and I can tell you at the age of 9, I was actually quite determined. As a child, I have always been one of those who was determined, and I knew what I wanted to do in life. So at 9, I knew that, yeah, okay, I'm going to work my way towards doing medicine in UM. Okay, so yeah, so of course my mom is also from UM. So my mom and dad, they were both from a class of 1972. So dad was MBBS 72, mom was Bachelor of Arts in 72. So the idea of UM, that's the sentimental part of it, I guess, but hey, if you can get yourself into premium university, why not? So I kind of like had that idea back in mind. So why medicine was chosen as a profession, I have a feeling, I suppose I can say that I had the first-hand view. I had the luxury of seeing how life was. And I'm not a very nice person, but I thought if at least 8-7 hours a day of my life I'm working at the hospital, helping someone, at least there should be some amount of pahala for me, isn't it? Even if I go about doing all the naughty stuff after work, and so so yeah, so it came quite naturally, and if you, the effect of TV and all that, you see that doctors have always been respected. I guess in my thinking process, I have always garnered respect and acknowledgement much more than money. And my dad was very determined. He was like, if you think that you're going to make money as a doctor, you're wasting your time. Because if you think that money is a go-to area, you'd be better off in economics or law or something else, finance, but not medicine. Because in medicine, you penat. It's a very tiring. It can be a very tiring profession. So did that answer why medicine was chosen?
Yeah, I think
Yeah,
very,
I
very
think
well.
so.
Yeah.
Yeah, because
Okay.
yeah.
Yeah.
That,
So
that's
maybe
that.
we move on to the next question.
Okay.
Why ONG?
All right. This is very interesting. Now, I I was actually after I did my SPM and I was waiting to go somewhere. I was actually offered to do economics, I think, in the UK or something. But I was hoping still to get into medicine. So I waited lah. I waited for you guys call it PASUM nowadays. We call it Asasi Science. Kan? So managed to get in, but I was so determined to do medicine that even at that time, as a 16, 17-year-old kid, we were already looking at areas macam Indonesia. IMU just started, so we ventured into those areas. And I remember telling the interviewers, I don't care where I go to do medicine. I just want to do medicine. Okay, so that explains the interest and the passion early on already. Okay, because some people would just be like, hey, you get an opportunity to go and study in London, why not? Tak kisahlah what field or subject matter pun. But actually, it's not that. I was even willing to go to Indonesia. Masa tu tak buka lagi tau. Russia semua tak ada tau in those days. We were only open to India or Indonesia was starting out. And IMU just started out. Yeah. So why obstetrics and gynecology? Now, as I managed to become a medical student, I realized that the subject, because in MBBS dulu, we had ONG twice. In our third professional and in our final year. So in our third pro, after your third professional, your third MBBS, that's your equivalent of what, your 3.1 now. We have a gap year where we have no exams. That's the fourth year. And during the fourth year, we did 8 weeks of pure obstetrics. Okay, so in the final year, we do another 8 weeks of gynecology. That's a lot. That's like actually 4 months, total of ONG, right? But when I was doing obstetrics, I realized that it was simple. When to deliver, how to deliver. Okay. Not enough period, too much period, no period. Okay, I mean the issues are simple and very logical. It required only a logical thinking process. Didn't require too much of my brains. I'm not a very brainy person. If I'm a very brainy person, I would have done medicine, internal medicine, I think. Okay, so that's kudos to Dr. Tan, who was your first specialist, kan? All right. But it was very logical. It was very practical, and it was a very happy situation. You deliver the baby, and the babies are delivered and they're happy. Mom is happy. The mother is always happy to receive this bundle of joy. It's not an actual disease. You deliver the baby, you give to the mother. The mother is happy. Thank you, doctor. Thank you, doctor. And then the next few days they go off. As we are speaking, since I am on call, this is the.
Oh, okay.
Yeah, this is the disadvantage. Hello, Doris. I'm in a live interview. Anything? Can you text me? Boleh? Can. All right, bye. Okay, these things happen. All right, but yeah, so it was simple. And then when we used to have class discussions, I could always ace the discussion process. It was very natural. Okay, but then of course you are talking as a medical student. Then of course you do your housemanship, and then you get to do lesson, and you cannot stand doing rounds from 8 in the morning sampai pukul 12, and I had to get my surgical itch sorted. But I also didn't want to do purely surgical, although I had a good time in surgery. Too many personalities, too much egos, and surgeons, the idea that surgeons are next to God, and that sort of thing. So tak boleh juga. Then I did pediatrics, and I like pediatrics, but I didn't enjoy living in an environment where children were sick. Because for me, children must be playing bicycles in the playground. So tak boleh. Then of course, I was set to orthopedics, and that's not for me. But then I got my stint in ONG. So ONG balik was like, again, even in those days, even as a houseman, I was already doing forceps and vacuum. So so the interest was already there, and the hands-on. And I don't know if you've noticed that my hands are very small. Have you noticed that my hands are very small?
I never noticed that. No.
You never noticed that, right? Yeah, my daughter says that my hands are like kitten's paws, and actually that has benefited me a lot because I can get into manual removal of the placenta quite easily. So these little things lah, you just feel, so that's why it's chosen. ONG is basically chosen because I'm one of those people who don't like to deal with chronic things. Right? I don't like people who have heart attacks and then they take medicine again and then they come back with a heart failure again and and then surgical is just too busy. But ONG has got a bit of medicine, right? I don't depend on the internal medicine people completely unless it's a very difficult case. I manage my own diabetes, I manage my own hypertension. I get to do my surgery. I get to do pelvic surgery. Better still, I get to do only the female pelvic surgery. So it's quite specified.
It's like 50-50, you get both.
Yeah, so it gives me a lot of satisfaction. Short and sweet most of the time. So yeah, that's why. Nothing chronic.
That's a very nice insight. I've never thought of it like that.
Really?
Yeah. I mean, I'm interested in ONG, but mainly because I like I like taking care of pregnant women and then like getting to see their babies. Mainly to very superficial, so to kan. But I've never had my ONG posting yet. So
beware.
Okay, we have some love sent from Yuzin.
Oh, hi Yuzin.
And also
She has just started. Kadir. Yeah. How are you guys?
Yeah. Okay. Ni tadi lah before you cakap tadi.
Right. Evening, Jelly.
Okay, so very wonderful.
Those two are really potentially good people who can be good housemaids, and you guys better make sure you find your areas. I think Eugen is still single and so is Kadir. I'm not sure. I think Kadir is single.
Kadir. Biar punya badan jawab lah kan. Okay, so next, after this question, we want to know what is the pathway to being one.
All right. I'll tell you my pathway. When I started out, and Anis, I've always been very truthful. Okay. When I was a houseman, I sibuk-sibuk lah buat my MRCOG part 1. Okay. I think that still is applicable now. You can do your MRCOG part 1, and after you're done with your part 1, you have to be attached to a center which is recognized and have a 4-year attachment before you can sit for your part 2. And then now they have a part 3. So in my time, masa tu, part 1 MRCOG tu kena buat dekat Singapore.
Oh.
Yeah, we had to go to Singapore. So I tried, I attempted. I'm not the most studious of people, So I tried, I didn't make it. Tapi I was a houseman lah masa tu, So subsequently, I applied to be a trainee lecturer in the university. So that was under the scheme Latihan Akademik Bumi Putra. And interviewed and accepted. So the benefit in those days was that once they accepted you in, then straight away you can join the master's program. But that I'm not sure whether it's still applicable now, because I don't think so. This SLAP program thing is like, kalau UM ada funds, ada masa, they will, they will offer open. Kalau tak ada, then tutup, macam tu lah. Alright, but that's the MRCOG pathway, the Royal College pathway. So that you can do privately on your own. Okay, it is not a regimented program, not by the government or whatever. But the local government program, which actually started out the master's program too, was by UM and UKM, and then subsequently USM joined us, and now UIA. So the master's program is conducted by the university, and they all sit in a conjoined board exam. Also, the program is also 4 years. Okay, so that's the part 1, part 2, habis lah. Then you become an obstetrician gynecologist. So waiting time to get into the program, I think now is like 3 years post housemanship. I'm not sure, I might be wrong. Because nowadays with the current housemanship issue, housemanship pun dah berapa tahun sekarang? 2. I mean, my time, my housemanship was 1.5 years. Because I also did orthopedics and peds. What about you guys?
I think
2 years?
2 years lah. That's what
so.
we put off in 2 years lah.
Yeah, so those things might change a little bit. But I think if I'm not mistaken, like our dean is working on the national curriculum review pathway where they can have a parallel program. So like macam if you have your MRCOG, you can also sit in for your MOG, your masters in ONG and something like that. Yeah. So that's your current pathway to be an ONG specialist.
I see. So Prof, you know, like in ONG itself, how many people do you usually accept per year in MONG?
30.
30.
And I think that's only one university. Yes, because macam UM, we have started taking the jarak jauh, meaning to say that they only come back to us in 3rd year.
So
dulu it was totally internal. So if you're from UM, you're totally like from year 1 to year 4. Okay. But UKM was always doing it as jarak jauh. So they could take more. So I do know that UKM has got a bigger intake. Maybe UM punya intake is probably 1/3. So the strategy there will be UKM will have a bigger network, betul tak? If they have more masters and more specialists, then the network around the country will also be UKM linked. So I think nowadays a lot of the universities pun dah ada banyak this jarak jauh punya program. Bukan jarak jauh, they come in at 3rd year. So they do their 3rd year and their 4th year in PPUM. The 1st year and 2nd year, they are in their Ministry of Health hospitals.
So that's what you mean by...
Yeah, because when I did my program, I was like, all 4 years was in PPUM.
Faham. Okay.
Plus minus lah. You know, sometimes you carry bad habits from other places. But of course, I used to be. Well, I wouldn't say. I was never bullied. But I was young. You know, sebab I masuk ikut SLAB. You know, I masuk ikut SLAB. So orang yang masuk dengan I tu, they were like 4 or 5 years older to me, and they were bigger than me and older than me. And I entered the program. Even as a 2nd year, I tak buat a proper Syaza by myself lagi tau. So because the first year, first year, we would be doing electives. So I actually did 6 months of urology and 6 months of anesthesia. Yeah, so we had that kind of exposure. So by the time I masuk 2nd year, I tak tahu buat Syaza. Of course, I felt very inferior.
Faham.
So there was this big senior guy, I remember him still, nama dia Go. Go was like taking in all the...
on life.
Go was taking all the first years masuk, you know, okay, where you from? Lepas tu bila dia sampai kat I, you know, don't know anything. Because I was his houseman. You know, so they this one 4 years, this ni dah buat ni, ni dah buat ni. So you feel very small tau. So I was thinking, what is my strategy? So I went up to Go and I said, you teach me. If you so terror, you teach me. You teach me how to do a Syaza. Sebab dia masa tu tengah nak sit for his exam.
Hmm.
I don't know if you're aware that the psychiatric ward sekarang ni dulu was a labour room.
Oh, I didn't know
Our
that.
labour room, the psychiatric wing was dulu for the longest time the ONG department. First floor tu is the labour suite. So at the back of the labour suite is the OT. So Paul will sit with his coffee and his newspaper, and I will be in the OT operating. So I will always owe it up to go for teaching me how to do a cesarean section. Lesson here is that when people scare you, you go back up to that person and ask them, "You okay? You bloody well, you better teach me." Are we allowed to swear here? I don't know.
we avoid that because we're live.
I was like, "You bloody well better teach me. If you think you're so terror, you teach me." So yeah, thanks to him.
Oh, yeah, fun
So
story.
does that answer your question?
Yeah, I think so. Yes. We have another person sending loves, Shahidil.
I feel so loved.
Okay, so more people come send in your loves in the comments, and then Prof can feel more of the love.
All right.
Nice. Okay. So, that was very insightful. Fun stories, definitely. Dan so nanti if we were ever in similar situations, bolehlah kita try cara Prof. Go
Kalau
back up.
berani kan?
Kalau kena pump up.
It works lah. Somehow I realized that actually face your fears, you know, you just, if you think that this person is going to bully you kan, you get the bull by the horns lah, and then you ask him to, he corner you lah. Basically I cornered him, like he had no choice lah. I mean, when someone tells you, "Can you teach me?" takkan you kata tak kot.
Yelah, betul.
Kan? So there you go.
Okay, so let's move on to the next question.
Right.
Quite fast hari ni. Okay, so next, your daily life as an obstetrician and gynecologist.
Alright, so as you can see now we are having this Facebook live thing and I'm on call. So okay, alright. No, it's okay. Nothing urgent. Okay, daily life as an obstetrician and gynecologist. Training as an obstetrician gynecologist is very much like your daily life lah. Like what you will live, you know, as long as you practice ONG. There are two parts, just in case some people are not clear. Obstetrics is the art and science of delivering babies. Okay? Gynecology is the field of treating women's diseases. Okay, more so related to the female reproductive system. Okay, so in the past, everybody was a general obstetrician and a general gynecologist. To be able to be an ONG specialist, you must be qualified in both. Okay, you have to be qualified in both. Daily life for me, okay, let's go through the schedule. Mondays are my operating days. Okay, in PPUM, I'm also the chief of team Delta now. Okay, so I take care of the Delta team. Mondays, Delta team have their operating days, gynae operations. Okay, gynae operations involve fibroids, cysts, tumors, things related to the female reproductive area. At the same time, there is also the obstetric list, the delivery list, lower segment cesarean sections that's being done. That's on Mondays. Tuesdays are our gynae clinic days. Okay, gynae clinic days. Wednesdays are our antenatal days, antenatal clinic days. Okay, so that's the obstetric bit. Thursdays are our on-call days, active days. So when you're on call in PPUM, you take care of the labor room, the early pregnancy assessment unit, and the emergency cases that come in through your emergency unit. Okay. Fridays, being in university, they have dedicated Fridays as your teaching days. Now remember, I may be an obstetrician and gynecologist, but I'm also an academic staff.
Mm.
Okay, so in between all that, all the routine service, I have teachings with the 3.2 students.
Mm.
You have your tutorials, CRS,
Yeah.
kan?
Yeah.
Lectures, okay?
PBL. Yeah.
PBL, and then your whatchamacallit, apa tu? Allah, now I cannot remember. The things that happen in the evenings, Susan. Is it CRS?
CRS usually
Clinical
like
something.
PBL.
Yeah,
Yeah,
and then,
the reasoning
yeah,
skill session, right?
yeah, and then
It-
and, and then your ni research work as an academician, we have to still produce papers.
Mhm.
So you every that is not what is experienced as an ONG specialist lah. Kalau you are an ONG specialist working in a government hospital,
Mhm.
your day-to-day work will be service. Service meaning maybe in the morning you do your ward rounds.
Mhm.
After your ward rounds, maybe you have your clinics,
Mhm.
and then of course your operations lah.
Mm.
Ah, so that's that. So academic staff ni dia different sikit. I'm sure your other
Yeah.
interviewees also mentioned that kan.
Mm.
Yeah. So we have actually a lot on our
Okay.
plate.
Mm.
Mm.
Okay. I think one question that has been, when we're thinking of being an ONG specialist, one question that is very important is like how busy it is, and then because a lot of people are pregnant, and how busy are you on a daily
Okay,
basis?
realistically speaking, okay, um, they say you're very busy, you won't have time, your husband nanti peluk bantal saja, all those things that people will say.
Mm.
But again, it's also how you prioritize your timing. Okay, like for example, let me go back to my father lah kan.
Mm.
He established practice in a 3 partnership. So he doesn't do it alone. So
Oh.
yeah, he has got 2 other partners with him. Okay, so they take turns, they go on call. So there are days when he's free kan.
Mm-mm.
On regular days, even in PPUM, I work from 8 sampai 4:30 lah. If I'm on call, then of course I work overnight,
Mm-hmm.
correct,
Yeah.
until 8 in the morning.
Mm-hmm.
But otherwise, actually, realistically speaking, if I'm working in a government hospital, I work till about 4:35. Now, if you are in the private center and you are a solo practitioner,
Mm-hmm.
then of course all your cases you have to attend.
Mm.
Yang itu yang you practically have to live next door to your hospital if you have a very prolific obstetric number of patients.
Faham.
Okay. Another thing about obstetrics and gynecology is that now there are a lot of subspecializations.
Mm.
So within obstetrics, there is the obstetric medicine, the fetal-maternal medicine, okay, high risk pregnancies.
Mm.
In gynecology, ada oncology, cancer,
Mm.
urogynecology, all the kencing problem and prolapse and all that, infertility. And for me, I'm more like a minimally invasive surgeon. I do gynae endoscopy. So that's my
Like
special
subspecialty.
area lah. That's my subspecialty lah. So there are many areas. So if let's say you are working in the university, in actual fact, you are not as busy as a private practitioner if you're solo. If you're a good doctor, if you have a lot of patients. I think if you ask people around, they will know that there are quite a few key people within the country yang memang very sibuk.
Mm.
That one I cannot do. Even I also surrender. No way.
Mm.
That's not the game for me. So you kind of like have to find what is the suitable and how to to get it done. But
So
when you're training as a master's trainee, of course it's tough. I mean, if I operate in the morning, I expect my trainee to go and see the patient in the evening. You see, you have to report to me. That's just part of your training. By about 7, 8 p.m. you kena lah pergi tengok patient tu okay ke tak okay, because you've cut her, you see.
Yeah.
So yeah, so that's our thing. But in actuality, kalau you habis kerja 4:30, actually you're done for the day kan? Because you have an on-call team.
Yeah. So Prof,
Not
masa
bad.
when you were training as a specialist, how busy was it? Like memang
Super busy.
juga ke? Memang
We have no shifts, yeah. Sorry, we ain't no factory workers, okay? We have no shifts. So you be on your toes daripada pukul 8 sampai pukul 8, 8 a.m. to 8 a.m. the next day.
and
The good thing is that, yeah, I mean, when you're on call and you go on call like 7, 8 times a month, okay? As a specialist, you go on call maybe 5, 6 times per month. Tapi you have to tidur hospital lah.
yelah. How do you function, Prof? 8 to
How do I
8,
function?
like sleep kan? Coffee.
This is tea. Today is tea.
Oh, tea, okay. Alternate,
Yeah.
is it?
How do you function? Okay, I reckon kan. Okay, this is the one thing that I want you to if I can tell this to to all of you kan, you guys are young, be honest with yourself, you know. If you are the kind who like love your beauty sleep, you memang suka tidur. You memang suka your quality time. You tak suka kelang kabut. You want to wear heels. Susah lah you nak pakai heels to work when you're an obstetrician. Takut you jatuh kat labor room tu. You know? Okay? But you be honest with yourself because in medicine, you can always find a field that fits you. Don't you think?
Yeah,
If you're an
there's
if you're an adrenaline junkie, you're into this high risk, extreme sports kind of thing, go and do, I don't know, anesthesia or something yang very challenging, or be an intensivist or something. You don't like to get your hands dirty, do internal medicine. If you think you're really cool and that personnel, you want to be open up the chest and all that, okay, then be a cardiothoracic surgeon or something, you know. But there's a field for everyone. There was one houseman who slept, and I have to tell this story juga lah so that you will remember. She slept while she was suturing an episiotomy. Okay, I don't like to repeat this story, but I think it is a story that needs to be retold. And she left one needle, okay, in the vagina. The patient was in pain the next day. MO went to see apa benda ni sebenarnya, and what we saw was that the whole introitus was actually sutured up. I rasa dia mamun. Dia mengantuk, you know. And she left one needle in there. So of course I was the consultant on call specialist kot masa tu. So I spoke to her. I said, now listen, I'm not saying that you can't be a doctor, but obviously I will not recommend you for surgical based postings. You get me or not? Maybe you will be an excellent pathologist. It's okay, you can leave 20 needles in a postmortem body. Tak apa. But there are certain things that you have to be very realistic with your own capabilities. If you're not a very hands-on person, then maybe the surgical, because benda-benda macam tu kan we cannot tell, betul tak? You can say I can do, but there we have also, I'm in the training committee for keyhole surgery kan. We know kalau this candidate boleh ke tak boleh buat, boleh ke tak boleh suture, dia punya pick up rate tu cepat ke tidak. You can usaha dengan gigih, but sometimes you're just it or you're not it, you know what I mean? So you have to be very honest with yourself. So that's it. But there's a field. There is a field in medicine for everyone.
Yeah, I agree. It's so much that it'll be hard to choose at the end.
Yeah.
I think, yeah, because personally for me, right, I think from when I was like a teenager, I think I wanted to be an ONG specialist.
Oh.
But then dah masuk third year, I found I had so much fun in medicine. Now dah terasa macam dah.
I remember the one time I entered Prof Adiba. Prof Adiba was a specialist masa tu, and I was so dread going to medical tutorials, and I dah lah masuk kelas lambat, and for God's sake dia panggil pula nama I was like, how is it that she knows my name? You know, I was like, Yeah,
Wow.
yeah, yeah, yeah.
But yeah, interesting, very interesting story. I think it's good to, take into consideration when we're going to consider what we're going to
Just
specialize
do
in.
whatever. Wherever you are, buat saja. If you are in orthopedic pun buat saja. Get muddled in the thing. You nak guna buat pediatrics, you buat saja. At the end of the posting, you will realize, okay, this is for me. Okay, this is not for me. You
Betul,
know?
betul. Oh, so true.
Dia lagi senang. Once you know, okay, this is not for me, dah settle out of the system. Because you must remember, as the houseman, you don't get opportunities to do ENT,
Yeah, yeah,
you
yeah.
know,
Correct.
radiology. So there's so and always speak to doctors, speak to your seniors, good seniors lah, who are honest
Mm.
lah, bukan people who want to
Get
sabotage you.
into it.
Yeah, yeah, you know, nanti dia ingat, oh, you're getting into their rice bowl, you know. No, but seriously, speak to people, and because if you speak amongst yourself, you don't really know the demands. But once you're within that field, then you know. I mean, my father, for one, has always said that do minimally invasive surgery. He saw it. He's very farsighted, so he saw the future. That's why, and I've never regretted it. Radiology has progressed in leaps and bounds with their intervention radiology.
Mm, mm.
Sorry to say, but the cardiologist has taken up a lot of the cardiothoracic surgeon's roles. You don't really need to undergo a cabbage now because they can stand up to 3, 4 vessels already now kan. So yeah,
Really?
so you have to look at the market. We will talk about the market later. I think
Yeah.
that's a question, right? Okay.
Yeah, that's a conclusion topic. Okay, I'm just
Yeah.
gonna protect some of the people dropping some comments here. Mostly emoji. We have some Dr. Nadia
Hey,
who come,
Nadia. What's she
and
doing
then
here? She's not a student.
she was the specialist before. We have
Ah,
one.
I see.
I think the emoji not compatible, so tak nampak apa-apa.
Apa benda tu? Yeah.
Yeah, and
Hamza
then we
has
have
graduated. Yeah.
a response to one of the topics we were talking about, and then also from Mr.
Alah.
Choi. Okay.
Joy. Yes. Are you
Okay,
nice?
so we talked a lot about being daily life as an ONG. Now let's go further. Your
Okay. Work-life balance.
mm-hmm.
Okay. Whoa. Where do we start? Sheesh. Okay, let's start.
Banyak kan?
You know what? Let's start the most important thing. Yourself. Okay, yourself dulu. I have never been a believer that you got to do one thing at a time. Because there's so many things to accomplish in life, kan? It's difficult to do just one thing at a time. So I know that a lot of my colleagues dulu, they were like, finish my masters first, then I'll think about marriage, or I'll think about, family and all that. But you also forgot and to realize that you are also aging. Okay, come on, do the calculation with me. You graduate at the age of what, 25?
Yeah, 25.
25? Okay.
I think.
Uh,
I tak ingat
yeah,
umur.
Yalah, 25. You graduate at the age of 25. 24, maybe 24, 25, okay? Then you don't enter your master's program immediately, right? You got 2 years and all that. So by the time you actually enter the program, you're like what, 30? Maybe? 32 sometimes.
Yeah.
Kan? So if you're gonna
If
like
you're
wait for
fortunate
another
to
4
enter.
years, you're gonna be 36. Okay? And personally, I've always been a greedy sort of person. I want a lot of things. So yeah, I may look like this, but I still want a family. I want my kids. I want I want my partner and all that. I want to have that if I can. So yeah, in a sense that planning is very important. Planning is very, very important. For me, you dah dapat you punya MBBS tu, that's your rice bowl. You're set for life. Worst case scenario, you can, just open up somewhere, do general practice and still be happy. True? Okay.
Maybe. Yeah.
Maybe lah kan? Okay,
Yeah.
And your masters, you shouldn't approach it as another battle or hassle or hurdle. If you like what you have chosen, it should be fun. So So this is what I always tell my cousins inside. This is what I always tell my trainees. Why are you complaining when you have chosen to do ONG? As far as I'm concerned, kalau you yang minta nak buat ONG, you should be like, yes, I'm going to do a cesarean section. Even if it is at 3 o'clock, die, I will do it. That kind of thing. Betul tak? Now, this goes out to all those who are going to take internal medicine, masters. So don't complain when people refer to you. You just have to remember, when people refer to you, it is because they cannot do it and they need someone else to solve it. That should be your motivation to say, okay, I'm going to go and see the case. Janganlah, penat lah, letih lah, penat lah, letih lah. Why do it in the first place? Yeah. Nobody put a knife to your throat and say that, you have to do ONG. Nobody put a knife to your throat and say that, okay, you better do internal medicine. Tak ada. You chose it. So, so that's apa ni lah. So, even in the master's program, I had my first child in, when did I have my first child? I had my first child after my part 1 exam. Okay. I wasn't gonna wait because I know, okay, after part 1 exam, there's still that few gap years, kan, before your final exam. So I had my child at school. I had my second child after I became a specialist. And I had my third child, okay, after that lah. Okay, so you gotta like plan lah juga. I mean, I'm all for say la vie and go with the flow. Tapi there are certain things in life that you sort of like need to plan. Especially, I mean, I'm talking more about family because in the end of it all, when you go to bed, kan, you're alone, Yeah. So even when you finish work, then what happens? Even if you go out for drinks with your friends, hoo-ha, 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 but then in the end you come back.
Who's there for you?
Right? Yeah. At least you know what I'll be doing tonight, yeah.
Yeah.
So, something. That's jokes aside, okay. What I'm saying is that family is still very important.
Yeah, I agree. Okay?
How do you balance it? I never bring family troubles to work. I don't use my family as an excuse. If I'm in a fight with my husband or if my children irritate me, all those things disappear the minute I enter the hospital. It shouldn't affect me. A lot of people will comment. Sometimes you get emotional bosses, and this is very particular to female bosses. What do your friends say? Kalau your female bosses become emotional, macam, something must have happened, she didn't get it, she got out on the wrong side of the bed. All those comments come in, right? All the misogynistic, comments come in, kan? Memang ada, kan? She's that time of the month and all that, kan? So don't allow yourself to be labeled as that. So I make a point the minute I enter the hospital, I don't use my family as an excuse. I don't use it. Anak I sakit. Okay, kalau anak I sakit, I'll sort that out lah. But that shouldn't affect my work. Similarly, when I come back from work, whatever that happens in the hospital disappears.
Stays in the hospital. Oh, okay, disappears.
Yeah, it stays in the hospital. My husband is also a doctor, so of course we need to talk. We need to talk about it. Of course we will talk about work, but that doesn't take up all of our time. So you need to compartmentalize your life. Tu belum lagi my administrative work. The things that I discussed with you.
It's a lot of administration.
I don't have a plate, Nadia. I have a tray. I have one of those dulang. I don't have a plate. I have one of those dulang yang ada gambar bunga-bunga kat tengah tu,
Yes, definitely.
But I don't know whether you remember me telling you this. Do it as long as it's fun. And you get something out of it. If it's not fun and there's no thrill and you don't make changes, get out of it. There's no point. So till today, I still get excited when I see a fibroid because I know, what am I going to do with it? I still get excited when I see pregnant ladies. You still get excited because once you like your work, it's actually like you waking up to do your hobby. That's cool, isn't it?
Yeah. Yeah. Very,
Can
very
waking
fun.
up to do your hobby,
Mm.
but planning is involved.
Mm.
Planning is involved. If you have a boyfriend now, then fikirlah, is this man worth it for you? Is this the time right? Because lepas ni nanti apa jadi? Nak buat masters ke apa? And I've told many students, be honest. Be very, very honest. If you're going to be very ambitious and you're going to get a boyfriend who's like, oh, but I need to be fed at 7 p.m. sharp and only my wife can cook for me, and it will not be the same if you're not around, then maybe this relationship will not work out. Because you see, the minute you accommodate, the minute you compromise, what you think is love is a sacrifice. I don't like sacrifice. I don't do sacrifices. Because somebody is losing when you sacrifice. You know?
Yeah.
Somebody is losing when you sacrifice, it's out of love. Bullshit, it's not love. It's to fit in with something somebody requested that you don't like. I believe in power couples. Both must pursue whatever they want to do, and both must prosper and blossom each other. Nobody should be left behind.
Agree. Definitely agree. Mm.
So not easy, but it works. And I think nowadays the men are also more exposed, so they're not so uh, protected as before. May get away with a lot of it. Actually, I think we'll do.
Wow. Okay, we have a question here. I think we're gonna discuss
Mm.
anyway afterwards, but I'm gonna just show it because okay.
Besides being a lecturer and a specialist, you're also a college master for KK6. What would you say your greatest challenges are in these different aspects of your career? Which particular challenge? The college or being a specialist?
Hmm. Both, I guess.
Hmm. Being a
Like,
lecturer and specialist, okay. Being a specialist, the challenge to me, the most challenging parts were completing the training,
mm,
because your goal is to be a specialist.
mm,
Okay, but once you become a specialist, you punya mata terbuka tau. You'll be like, oh, what can I do? What can I, you'll be like, so many new areas for me to look into, so many new subspecialties. You never stop learning. Masa you
mm,
medical student, you belajar banyak benda. And then masa
mm,
you ONG, you kata you buat ONG, but you're going deeper, right? Kan?
mm,
Then
mm,
after you've done ONG, you're even going deeper lagi when you're doing subspecialization. So new opportunities, new information, new ideas come about. So that was it was fun. As a specialist, it was fun. What was not fun was waiting to be promoted. Okay, that was to me the biggest challenge as a specialist, because as a clinical doctor, you sibuk, you're on your toes. You can ask anybody. I'm never in my room. I'm very rarely in my room.
yeah.
So by the time you nak balik, nak duduk labur punggung, you nak duduk nak buat research, dah pukul 4:30. You dah
Mm,
penat, kan?
mm,
So that system is not so supportive within, for me. Maybe I yang tak pandai how to manage that, because being a lecturer, your key performing index requires
mm,
you to have publications.
yeah.
Requires you to have publications, so you actually need to sit and write a
Yeah.
research. Okay, then they say you have master students who can supervise and do your research. True, but that also needs a lot of work.
Mm-hmm.
So being promoted. So for the longest time, I was like in a rut, thinking, oh, will I ever be promoted? And it's not easy. To a point, sometimes you segan because you're not even a prof yet, and people already refer to you as prof. Bloody hell, maybe they think that you're already so old and been around for too long.
Mm.
So that is one challenge. Now I have different challenges. Now I don't have a challenge so much in terms of the ONG itself, but I have challenges like trying to turn you guys from lambs to lions. I don't want you guys to be, so we take on different challenges every time, don't we? So out of the blue, you decide to become a college master. I never thought I would become a college mistress. No way. Never thought about it at all. Tapi
Yeah.
yeah, then I saw my students so tired when they come for my tutorials, and I'm like, why? And then I found out that you guys start the proper meals because you don't have a canteen anymore. Then I delved into it deeper, and I delved into it deeper. Then I thought, okay, Firdaus Hariri recommended that. He said, hey, maybe you should do something about it. I think you can do. So I just took it upon that. And I can say that I'm quite happy lah. At least I got that thing sorted out. And then issues of penempatan, it's never enough. But as you said, I'm also, I try to be very honest. So whenever I say something, it stays the same because I don't lie. So I don't have to think of excuses. When I repeat myself pun benda tu yang sama.
Yeah.
Ada penempatan, ada penempatan. Tak ada penempatan, tak ada penempatan. This penempatan is for clinical student. Yeah, it's for clinical student. Sorry, I don't have enough spaces. I don't make excuses. So challenge being KK6. Actually, KK6 ni is more of like
we are the challenge, isn't it?
You see, the thing is that you didn't request for me to be there. Betul tak? But it's nice if you are able to leave an impression on young minds. Put it this way lah. If you can remember me, I'm happy. You know what I mean? I think that makes me happy. To leave a legacy, to be remembered, to be thought of as a teacher. I think I'm happy enough already. Yeah, to be thought of as a impressionable teacher. That makes me happy. So if there's some of me that can rub off you, yeah, I'll be happy.
Yeah.
Yeah.
I think that's important in life. I definitely agree with that because I would try my best to help about as well, maybe with my juniors, because I feel like it gives me a lot of satisfaction.
Yeah.
So I'd say,
you know why I use this cup today? You tengok ni, do you see this? Yeah.
Yeah. Okay, boleh nampak.
I teach you enthusiasm. Apparently, when I was taking class, I said this. I tak ingat. Tapi, but it's true. It's true.
By Prof Aizura.
Yeah. Posting J gave me this mark. I was in team B, posting J. So it leaves an impression, right? So I've done my job. I'm happy. So even if I'm tired, but I know that there are students who appreciate me, I'm happy. I'm happy.
Okay.
So does that answer your question?
We'll let Raymond, because Raymond was the one who asked, right?
Yeah.
So we'll let him comment after this if it answers his question, or does he have any more questions, right? So I think so how do you manage administratively? Because you're very busy with clinic sessions, and then you have operations, you have teaching days, you have research to do, but then you also have to attend meetings in administrative levels. Like, I think in college itself, it's not really a big problem since we usually adhere to you. To get you around. Okay, for context, for everyone watching, I was a GTK as well, so I've worked with Prof Aizura before.
Was it difficult to get me? No, right?
Sorry.
Was it difficult to get me?
No, I don't think so. Because you always answer fast. So if anything, you never leave us hanging, So if you're busy, then you tell us you're busy. So then we change the time lah kan. But isn't it a challenge in terms of, since you're a college master in KK6, then at HEPA, and then since you're also the head of clinical skills unit in FOM, then at FOM also it's a challenge, right? So how do you manage this, in time?
The administrative times?
Like administrative work
First of
itself.
all, again comes prioritization.
Mm-hmm.
I'm not supposed to say this. This is not very good for you guys to know. But off the record, 50% of the time, most of these meetings are nothing. It's a waste of time. Okay? So you prioritize. Which thing needs to come first? Sometimes, a lot of it, I think, is also God's help. Sometimes you just wake up and say, oh God, so many things happening today. And then in the next thing, you go like, ini tak jadi, orang ni tak datang, oh that meeting got postponed. You know, sometimes those are super good days if such things happen. Can you just hold on? My son is screaming.
Boleh. Tanpa Prof.
Adlan! Adlan! Jangan bising sangat. Tell me. Yeah. See? Prioritization. Okay. So now, for example, the CSU too is my jihad to get the building sorted at least before I can change. That's also for training purposes, kan?
Yeah.
So that's not that much activity, but more the idea of pushing the idea forward for UM to start the building refurbishment and all that. In terms of merdu meetings for coordinating program and all that too, we can share out the job. I believe in delegation. You know that you cannot be a superwoman. Something will break somewhere. Will break somewhere. Tak boleh. But in actual fact, boleh lah. You can still attend certain meetings. And certain meetings yang I terlepas pun, when you find out after that what happened, nothing much. So you know, and now lagi lah with all the online meetings that we have, people are attending 2-3 meetings at the same time. I mean, if really something crucially needs your time, you know, so far it's been okay. Honestly, the college doesn't burden me. Okay, and number 2, I don't give empty promises. If I'm busy for the day. Tapi we'll get to you immediately after that anyway. And I like to, I like to settle things cepat-cepat. So you can, so I don't have a lot of perkara-perkara tertunda, tak ada. Benda tu, you want to see me, okay? I'm here, can you come and see me now? We settle it and executive decisions must be made.
Yeah.
Betul tak? So that is at least, I think, part of training as an ONG specialist. You make decisions very fast. Part of training as a doctor, you make decisions very fast. Training as an ONG specialist, doubly fast compared to a lawyer. Lawyer tu cannot make decisions very fast. Kalau ni macam ni, kalau tu macam tu. So you know, so it's personality. And there's something about the personality of an ONG specialist ni. Dia memang suka buat banyak benda, I think. Prof Jami.
Oh yes.
You know? Prof Zaleha was a dekan UKM, ONG, quite a few. I don't know. Passion is always associated with ONG. Terkejar-kejar. Tak tahu lah. I don't know. But yeah.
Faham.
Okay.
We have a response from Raven. So thank you, Prof, for the answer.
No problem.
Yes, we've been interested in your perspective. So yeah. So great answer from Prof. Okay, so our next topic, a lot already, but okay, I think we have 2 more topics. Number one, this one I think has been talked by you, so we're on to our last topic of the day. So yeah, future.
Okay, future. Okay, as a young ONG specialist, all of us usually are in love with the obstetric work. Easy money, orang bersalin all the time, you know. And I remember one of my seniors taught me, 90% of the time, babies will be delivered without your help. Okay, there are normal cases. ONG specialists are trained. ONG specialists are trained to take care of that 10%. That when it is a complication, it is a very, very morbid, even mortal complication. Okay, because it can involve death of a mother or a mother with a child. That's very sad.
Yeah,
Okay, so
definitely.
I believe so. Tigers and monkeys in the jungles, they don't have obstetricians. Elok je. They still
Mm.
produce tigers, monkeys, and elephants, right?
Mm.
Why is it that human beings need obstetricians, right?
Mm.
Because of your value of life. So when you're young, it's very nice. It's very instant gratification. Baby deliver, oh you happy, you suture up, settle, everything habis, you know. Then you realize that the statistics catch up with you. As you grow older, you have more cases. Of course, generally you will have more complications.
Mm.
And as an ONG specialist, you have to stay humble because you don't know when somebody might bite your back.
Mm.
Okay,
Mm.
you do a spontaneous vaginal delivery, people may pat your back. But if you don't call for a cesarean section properly and there is a death or a flat baby or a baby who is cerebrally asphyxiated, everybody buggers you. Victory has a lot of others. Failure is an orphan. You're always alone when you fail. Why am I talking about this? It's because of the medical legal implications.
Mm.
The medical legal implications in this country for obstetrics is very high. On an average, patients can sue you till the child is 18 years old, and they can sue for certain reasons. They can sue for up to 5 million. That's enough to make you a bankrupt. Okay, and you know how much we pay for our premium for insurance? For a 3 million coverage, we pay 23,000 per annum per year. Burn. That's it. That's only for a coverage of 3 million. If you get sued 5 million, that's it. Okay, so obstetric, Malaysian Medical Council ke, you nak kata Malaysian Medical Association ke apa ke, I think kita punya legislations to protect the doctors tu belum murni lagi, belum perfect. Okay, so that's an issue. Medical legal lah. Banyak orang run away as they age from obstetrics. They run away from doing the bulk of obstetrics because of the medical legal implications. And future, with the current people and the current market and the current practice, I can see that people don't really like to go to male obstetricians.
Yeah. Mm.
They prefer female.
Mm.
Okay. Yeah, dude, sorry, unfortunately the market's not for you guys. In obstetrics. Tapi if you're doing fetal-maternal medicine where they doesn't matter kan whether it's male or female kan when you're ultrasounding the baby and all that. Gynae oncology like Prof. Lim and Prof. Siva, they are all gynae oncologists kan. My father's a gynae oncologist kan. So those issues tak apa, but it's just that when it comes to obstetrics per se, they tend to seek female obstetricians. So if you think you're going to make your money from doing deliveries, you are at an advantage if you are Malay and you pakai tudung. Okay? And if you're a Malay who speaks Chinese, I'm keeping it real, okay? I mean, don't call me apa ke, but I'm telling you what the public want. You know? But for the other fields of ONG boleh. The males can also do it. Urogynecology. It's just that because it's a very private area kan, of your body kan. So they feel more comfortable talking to a lady about it.
Yeah.
And when there are options, why not? But as it is, the medical fraternity is being populated more by women anyway.
Yeah.
So I'm not surprised lah if ONG specialists in future become 100% female pun no issue lah for me.
Faham. In terms of there are too much specialists, is that happening or there is never too much specialists for ONG?
There are two, dia depends on where you stay. Back in the day when I was in Ipoh as a child, my dad is the only Malay private practitioner. Okay. And then dalam Ipoh Specialist Center tu, now known as KPJ Ipoh, there were only 3 clinics. So my dad set up another Dr. Mahadeva and another Dr. Luluan, for example. Sekarang ada maybe 8 different setups, 8 different practitioners. Ipoh is not a very large growing population kind of place. Again. So the cake is still the same. The growth rate is still the same. But now the cake, instead of being shared by 3, is being shared by 8. So you get me? You know, you do the math. So a lot of people, if you say in the private setups pun, private setups, yes, kalau the big hospitals tu sekarang dah jadi macam mega mall. They don't care. They can fill you up. You have your choice. But there may be so many, you know, specialists in that field in one sector, in maybe in Klang Valley. But there are so many areas within Malaysia lagi yang ketandusan specialist tu masih ada. My trainee just told me that in Miri, was it Miri? She was in Miri. What? Miri ke Sibu one of those places lah. Oh, Sarike. In Sarike tak ada specialist. So the MOs go for a 2-week training course on how to do a cesarean section.
Oh.
And after that, you go and perform. Gila tak gila in this day and age? Kita dah merdeka berapa lama dah? You know what I mean? So and I say this again and again. I'm not sure whether Banting has a fully run ONG unit, fully run emergency hours open. I don't think so. OT for cesarean sections. I remember when I was doing my attachment in Klang, I would get phone calls. Banting, we are sending you a patient in an ambulance because we tried to attempt a vacuum and not successful, but we cannot do a Caesar.
Because no specialist.
Half an hour journey. By the time patient comes, your heart dah drop to your shoes already. You don't know what to expect. So, yeah, the distribution is not equal. Distribution is not equal.
There needs to be more at certain places.
Yeah.
Too much, but you know.
Ideally, what do I want for ONG? What do I want for ONG is maybe better pay for everyone, and maybe for the government to have a cap on how much they can sue the doctors. For respect of the fact that we are actually trying to help, and nobody tries to sabotage patients. But we are also only humans. We are not infallible. Mistakes can happen. Unless it's like negligence. You know, janganlah teruk sangat nak cari salah doctors ni. That's why I said I have very low threshold for lawyers. Sorry. Because that's usually the thing. They always try to find fault with the doctors, with the ONG specialists.
Lagi-lagi kan?
We're trying to help. Fardu kifayah pun. You know? Yeah. Okay, so that's what I wish for.
Okay, I'm writing one more question here. We have a fun question. Maybe if you would like to answer lah kan. Not really related to ONG. From the Google Forms. So this person wished to stay anonymous. Maybe
what is the reason of not allowing people to drink water in front of you? Well, it's a style. It's just the amount of respect that I wish you have. Okay? When you attend a class, and if you're serious about the class, how is it that you can drink your life away? I mean, you know, it's a sign of respect. Unless you're dehydrated. If you're so dehydrated, then of course you need a IV line, you know. But you just masuk class I, and there's this 1.5 liter of water, and you go glug 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 drinking. I don't know. Maybe you come from a different standard of upbringing, because when I was in school, we never did that. And perhaps if you want to be upset with me, then you have to be upset with my convent teachers lah. Because for us, it was always a sign of respect. If you need to do anything, drink or whatever, you go out of the class and drink. I was just brought up that way. But if your upbringing and your school allowed you to, then so be it lah. So one day when you conduct your own class, then you pour the drinks for all your students. But if you want to learn from me, you go by the way I sort out lah. If that's what I want, I'm not asking you to do something criminal. I'm just saying that don't glug your way through in my class. I find it disrespectful. Period. That's all.
Faham. Okay. We have one more question that's also unrelated to ONG, but
Gee.
I think people want to know more about you, Prof. So
Okay, carry on. Thank you.
okay. So the full question is this, but I'm just gonna I'm reading the full question, but hi, Prof. It is understandable that the clinical skills unit in the faculty is run down and outdated, and the management has lack of fundings to upgrade facilities in the faculty. As you've mentioned, that now you are the head of the CSU. What plans do you have for the CSU, and what do you hope to achieve?
And I will openly tell you here as well. I have been working on the CSU since 2015. Okay? Back in 2015, I have asked Prof. Adiba that we need a wet lab because I run the animal workshop. I run a yearly international animal workshop where we sedate pigs and we get people to practice laparoscopic work on the pigs. Live lah, ventilated and all that. And it is internationally recognized and does not have a place. I have been working on that project trying to get money and funding since 2015. It has gone all the way up to Rancangan Malaysia ke-11, ke-12, whatever. But unfortunately, or the government for that matter don't think that education and training is that important. So, I did not want to be the head of a rundown kapal buruk kind of unit, but I was interested in turning CSU into a clinical skills and simulation center, which I have been dedicatedly working since 2015 with Dr. Nur Jahan, if you know her, from anesthesia. All right. So when Prof. Jamia retired, then the VC asked me. I had to attend the interview. And during the interview, I was blatantly honest. I said, Dato', I am not going to be a director of a glorified store. I am not a glorified storekeeper. Nak simpan barang-barang buruk. I do not want that. Because it will look bad on me. Obviously, you know by now, I'm pretty proud of what I do. And I like to look good in what I do. Kan? So I said, if you want me to be the director of CSU, please give me the 5 million for refurbishment. Because if you give me the money, then I can work something out. And that was the deal. Okay? And that was the deal in January. Okay? And then MCO. And then I assume since I got the job, VC would give me lah the 5 million kan? The promised money, right? But there's going to be another meeting. Well, you know, this is why I say I'm no good with bureaucracy because I have no patience for meetings. So there's a JTK meeting, then there's a JAPRO meeting, then there's another meeting. All this meeting. I'm hoping that something will come out because apparently there will be a meeting on the 1st of September. And if that meeting on 1st of September comes through and we are approved, then I'm hoping that it will stage the phase 1 of turning CSU into a CSSC. What do I hope to achieve? I want CSU to become like ERCAT in Strasbourg. IRCAD, check it out. Training center,
just the other day. Very, very interesting.
Yeah. Okay. I hope for that. And unfortunately, I dream big. And if people think that, there are some people who think that I live in utopia and I'm living in a la la land. But hopefully before I pension lah, it will turn into a SSC.
Mm-hmm.
Yeah, so that's what I hope to do. There
I
is
hope.
nothing that I not hope to do. Before I was a head of CSU unit, the project has been in plan, the business proposal, the program, all that, took it on the plan or everything. But still, in the end of it all, I don't have the money for it. Any of you guys out there who have benevolent uncles, aunties, parents who wants to name a building after your mother, your father, whatever, come. I'm willing to talk to anyone.
Okay, guys, dengar tu. Then we can have better facilities for
Yeah,
UMMC students.
you know, I want
Even
to plan. I want to plan for the medical students to have an access card.
Hmm.
Keluar dari college ikut pintu belakang tu, you masuk
Yeah.
ikut CSU pintu belakang, we'll have a lift kat situ, go you all the way up to the arcade. You can play the simulation setup kat sana, you can chill, there'll be a small cafe, if not a cafe, but yeah, it'll be like a hangout thing, 24 hours. So many things can be better, but until and unless the government realize that education and training is important, it's difficult.
Okay.
I will try.
I appreciate your effort for trying. But we all know it's very hard kan nak build facilities, especially in UM, and then okay, just
Does
an
that answer
open.
your question? Yeah, I hope you
Yeah,
understand the
so
plans,
very much. Yeah, very exciting. Just a public announcement to the people who are watching. We are now entering the Q&A section of the session. So feel free to post your questions. You can post them in the Google form that we've linked. We've got a few questions as well. And we will probably stop when Prof would like. So now, next question. Raymond
Ni
again.
dah
What?
jawab lah.
Tak, ni
Oh,
baru.
what are
Miles
some of the milestones along
along
your
your
journey? Come on, man. I don't want to talk about what I've done. Let me die, and then you guys can talk about what I've done. Well, it's not cool lah. I mean, check it out yourselves lah. Kalau
Hashtag
I'm
stay
not
humble.
gonna. Oh, there? Yeah, I'm not gonna. Yeah. I don't have a teng. Tak apa. Nanti when I die and I go off, then you all can talk about whatever I've done. If there are anything that you think that I've done.
Okay, wow. Okay, next question. And I think I was about to ask this question anyway, but here from Melissa, what is the advice that you will give to medical students and graduates who are interested in ONG?
If you're interested in ONG, I advise you to do everything else first and make sure that you don't like everything else first, and then you will be, you'll be quite sure that you like ONG. You will like ONG because you are exposed to ONG early in your life. Early in your life, when you're exposed to something, it's very impressionable. But as I said again, there are so many other fields which were not ventured into as a medical student proper. And sometimes, even as a houseman, you don't get into it. So keep yourself an open mind. And if you are interested in ONG, go ahead. Be interested in ONG and delve into it. If you have the time and the effort to sit down and study, sorry lah, I was a houseman dulu, baru dapat duit kan. Enjoy lah. But if you can sit down and study, do your part one, because the parallel programs are coming on. And if the parallel programs are coming on, you don't really have to follow through the master's program to become a specialist. Why not? Yeah, go ahead. I encourage people to do ONG. I'm gonna have kids. Maybe I'll be menggeletar je, I cannot deliver my own kids, cucu ke apa kan. So yeah, you guys need to do it.
Exactly, yeah. Okay.
I would never discourage anybody from doing ONG. But I'm not going to force anybody to do ONG. My concept is very simple. The minute I see you in ONG department, I know that you want to do ONG. If you complain, you're wasting my time. No. You want it. You should be more hungry than I am.
Yeah.
Right? You should be more hungry than I am. So when you come to my class as an MBBS student, you should be more hungry than I am. I want this. I want to get through this class. I want my MBBS. So I don't have to justify anything. You just have to live with me.
I tak rasa lagi, Prof. I tak rasa lagi. Be kind.
One thing is that, you know, by the time I'm done with you, I would have like psychoed you all so much that that's why I say no more lambs, all lions, all willing to fight.
Okay. We have another question from the Google Forms. So, how often does fatality occur in obstetrics, and what is the most common complication?
Okay. When you say common complications that we fear most are hypoxia lah. Okay. We don't like hypoxia, ischemic encephalopathy and all that. Fatality is not common, and which is why if you have a fatality, we have big meetings up to the daerah level and all that. So yeah. How often does it occur? I cannot quote the statistics at this point in time, but I think it's less than 5%. And most of it is because we have improved our quality of care, so it's no longer postpartum hemorrhage. Now it's more like medical diseases in pregnancy. Kalau dulu we used to have a lot of deaths because of tumpah darah, postpartum hemorrhage. Now I think we're controlling that. Yeah, I'm very sure it's less than 10%. Fatality. Common complication, shoulder dystocia, fetal distress, baby floppy, that kind of thing.
Okay. So I think dah about 1 hour and 35 minutes lah.
Yeah.
So quite long already. So I think this is
yeah.
So I think this is our last question for the day.
Okay.
Okay. What's the most challenging issue that Prof has faced during delivery, and how did you handle it?
Okay. How did I handle it? All right. Thank you, Eugen. Most challenging issue is during delivery. During delivery, okay, I'm going to relate a story to you. A story of how people will play back. People will play your back because they want to survive. We were on a shift sebab tengah-tengah pagi kan. So usually what happens is that if there are not many cases, one medical officer will be sleeping from 12, katalah from 12 to 4, and the other one will wake up from 4 to 8, macam tu, you know. So it was my time. I looked at the CTG. I didn't like the CTG. It looked a bit suspicious. So I called my specialist. I told my specialist, I'm not too happy. Tapi I baru bangun kan. I looked at it. So I delivered the baby and the baby was flat. Okay, the baby was flat. So, because I was a junior, people were blaming me. You understand tak? They were sort of like blaming me, kenapa baby too flat. Tapi I kata, I did the Caesar. I picked it up. You know, so, and when you're immature, you pun tak tahu macam mana nak defend yourself. You know? You cannot, you belum pandai nak defend yourself. So, of course, when we actually had to present the case, it was very obvious. Somebody missed it. But when I took over, I detected it. So how could it have been my fault? You know? So the biggest challenge that I face is trust. Who do you trust? How do you defend yourself? And I face that every day, which is why whenever you all tell me something, I don't take it bulat-bulat, remember? I will always be like, I don't know. I keep telling you, don't trust me. I don't trust you. I will find out myself. Why? Because you can turn it against me as well. So, being a good ONG specialist, you must not trust anybody. You have to gauge things for yourself. So that was the thing, and of course the case was brought up to M&M lah. M&M is our morbidity and mortality meeting kan. But that's the one thing that I also like about ONG is that it's not a blaming game. You have to decipher and analyze the situation, at least being in PPUM, where the approach is very academic. So just because you're senior doesn't mean you're right. Just because you're junior doesn't mean you have to swallow. So we had it discussed and all that, and we pointed out clearly where was the fault and all that. And in the end, it worked out fine. So to answer the question, how did I handle it? Get your facts right, and never lie. Never lie. Because if you lie, takut you tak ingat what you lied before. But if you're always telling the truth, you're just replicating it again and again without any conscience affected. So go in with an honest heart. I've had my shares of shoulder dystocia. I've had my shares of coming in and having to grab the posterior shoulder out and tarik baby keluar and all that. Yeah, that was challenging, adrenaline rush and all that. But that was not the most challenging. Actually, I don't want to face a very challenging issue because I'm thankful to God. I've been quite safe. I mean, God has protected me quite well.
Very personal. Okay. So I think that's our last question. Definitely. Dah quite panjang dah. 1 jam 40 minit.
Am I allowed to drink now?
Okay. But anyway, if anyone would like to give your comments or like your ending comments, ending appreciation to Prof, do so now while we're ending. So tadi Yuzen ada post.
Yeah, she's always so worried about me. Thank you. She's always so worried that I'm not taking care of myself. But trust me, I will. Thank you so much for your concern.
Okay. But
and I wish her all the best. I wish her all the best because she's like going to undergo her housemanship. So yeah, keep in touch. Yes. My user is going to do her housemanship. So good luck to you.
Good luck. All the best. Okay. But anyway, okay, we have one more from Raymond. Thank you, Prof. Banyak tanya soalan hari ni. Okay.
I hope you enjoyed yourself. At least I hope it has given you a bit of insight. It may not be the whole truth. It is the whole truth on my portion, but other doctors may not share my same, insight. But that's that. I'm just keeping it real.
Okay. One more for Jet from Jet Lee. And one more from Melissa. Thank you, everyone. So I think
you guys are really nerds. You guys don't do anything on Friday nights. Tengok Facebook. Oh man.
We make time to see you, Prof.
I don't know. In the day, I don't think I'll be. I mean, well, whatever.
I know, bro. I know. Okay. And one more from Ian. Okay. But anyway, guys, very, very a huge thank you to Prof for
entertaining me as well.
Yeah, it's very insightful, honestly, for me. And then, okay, we have an interesting comment here.
Not a UM student, not in BBS, but why are you even here? My God. But Prof said I'm not drinking in class and being hungry for knowledge more than the specialist does. Yeah. Okay.
But thank you very much, and thank you everyone for tuning in to our session. This is actually our last session for our MEDSOC session lah. If there is anything in the future, probably the next MEDSOC punya administration lah. So this is our last episode, very special episode with Prof Aizura. Thank you everyone for tuning in. All the best everyone in ONG.
Thank you everyone.
Hopefully you guys will see Prof Aizura juga.
3.2.
3.2. I guess I hope to see you. Right. Okay. So thank you, Prof. Thank you so much. Thank you so much for agreeing and just being a good sport about everything. Okay. So I guess we'll just end it like this, right?
Yeah.
Okay. Dah 2:30 dah pun. So
Yeah.
thank you everyone again. And see you anytime soon.
Yeah.
Okay, bye.
Bye
Bye,
bye. Good
Prof.
night. Assalamualaikum.
Okay,
Bye
I'm
bye.
ending broadcast now. Okay, bye.